So bipolar disorder is a mood disorder. So there's two types of mood disorder. There's depression, major depression, and there's a bipolar disorder. So as you can tell from the name, it's bipolar. That means there's two portions of it. There is a maniac episode and there is a depressive episode. You can check my video on depression. So they have like SIGECAPS, depression, these are the symptoms. For bipolar, these are the symptoms. For bipolar, there's two types. They have two symptoms, maniac episodes and depressive episodes. There is two types. There is bipolar type 1 and type 2. The type, it doesn't matter. The one, basically, you need at least 1 week of episode of maniac plus the depression. The type 2, usually they have a very low episodes, maniac episodes, and they have profound depression. So how will they present? Well, most of them will present in a maniac form. That's mostly the type 1 form. And so the maniac presentation is usually straightforward. You can think about it like euphoria state. Everything is up. Like anything you can think of on this patient. So if they give you answer choice, don't pick anything that will go down. The answer choice have to be up. So they have elevated euphoria. So they feel great. Okay, too much, over too much most of the time, and then the activity, if they usually really dull, the activity is like too much. So they will be like exercising non-stop. They're like moving around. If they're talking, they won't stop talking. So they will have like pressure in speech. So they will talk non-stop. One sentence never ends, and they keep on talking and talking. They become like talkative, non-stop talking because they have too much energy. And they have too much energy. Anybody who have too much energy, if the car has too much energy, it will never stop. So they can't stop. They can't stop moving. Okay, they're moving from one place to another, moving non-stop. They can't stay still. There's no way they can stay still. Somebody who doesn't go to the mall, these people will spend a lot of money. So they start spending unnecessarily things that they don't need. They will be spending it. If you live with them in the house, they will be cleaning the whole house 24/7. No moving. That's the moving. They keep on moving and moving and moving. And they will have poor attention because of what they're doing. They move from one thing to another, no break. So they keep on going non-stop. Okay. But this is another thing you should know. They will have impulse control. They can control their impulse. If I'm doing all these things, I'm like moving around, can spending, poor, concentration, like impulse control, very euphoric, where I will not be able to sleep. So insomnia. So they won't sleep for like 2-3 days because they keep on going. That's the maniac state. But don't forget, they can have delusion and hallucination. They are not schizophrenic, but they can get this delusion and hallucination in the acute episode of acute maniac episode. If all this is going on, they're spending money, they're moving around non-stop, they're sweeping the house, you feel it, they're delusional, they like can't sleep. This is what I'm worried about. They neglect themselves, neglect personal care. Okay. What does that mean? Well, they're not going to eat, so dehydration. Nutrition is bad. They don't have time to eat at all. They can't sleep. And then hygiene. Basically, personal care, all the ADLs, they can't do that. They've neglected it to somebody else to do it for them, basically, because they're paying attention to unnecessary stuff. This is your priority when you're seeing them. Every psych question, psych patient from Maslow, you have to pay attention to their physical need. So physical need. If you come in with pressure speak, euphoria, poor concentration, impulse control and everything, delusion and everything, what I care about is neglect, physical needs. So you have to provide their physical need, hydrate them, give them food, let them sleep, get them to take care of themselves. So that is your priority. Taking care of themselves is a priority need compared to psychological need. So that's a priority for you to take care of for them. So how do you treat them? Well, there's a lot of medications that you can use, but the number one is lithium. You can also use antipsychotic or anti-seizure medication, which is number 3. This is number 1. So that's what almost everybody on who has many bipolar disorder is on lithium. So we're going to focus our attention on lithium because that's what the question will be on most of the time, is on lithium. So what is lithium? Well, it's a medication. So usually you'll see that they will write it lithium carbonate. Okay, this is a very powerful medication. It has a very small therapeutic range, so 0.6 to 1.2 milli equivalent per liter. So very, very narrow, very narrow. So it can become toxic quickly. The toxic level is 1.5. Greater than or equal to 5 is toxic. So you don't have a room at all. Therefore, these people, they need to check levels. They need a frequent lab draw most of the time. As every medication, like I told you, pharmacologically, it's very important to know pathophysiology, but we're going to not pay attention and focus on that too much. But just few things based on the way lithium function that you need to know. Expected finding. They can ask you this question, and when they give you lithium toxicity, they will put expected and the bad one, toxicity. When you take lithium, there are a little bit of anticholinergic effects, so they get like dry mouth, and then because it causes a little bit of dehydration and then anticholinergic, so they have dry mouth. It will also make you gain weight, so weight gain, and it makes you drowsy. Drowsiness. These are expected finding of lithium. So these are expected. They give you this in the list of starter questions. Somebody coming with priority. Well, if he has dry mouth, I don't care. That's expected. It will go away. If they're gaining weight, it will go away. Drowsiness will go away. I'm just worried about something that will kill them. I'm being sharp. That means you have to be sharp. Any priority question, try to be sharp. This is not being sharp. This is being expected. So that's an expected finding of lithium. So when they give you a priority question, don't look for the expected finding, okay? The things that they like to trick you with is the side effects, okay? Side effects of lithium, okay? Most medications, when the first signs of toxicity is GI symptoms. So mostly when you're taking medication that it's becoming more toxic, even the digoxin, most medication, 95% of them, you get GI symptoms. So to be careful. That's the early signs. Your body doesn't like it. So because you take in by mouth, irritate your stomach, and you get GI symptoms. So they'll get like nausea, vomit, and diarrhea. When you see it, don't just let it go. This is toxicity. This is toxic. This is the early signs of lithium toxicity. Patient need to be informed that they need to come in right away and do something about it. So GI symptoms is number one symptoms of toxicity. Okay, so nausea, vomiting, diarrhea, you should worry about it. That is something you should worry about. You have to be sharp about this. This is the toxicity. It makes them sick. Lithium is cleared by the kidney. So kidney would be used for clearance. Okay, it's cleared by it. Therefore, if you have your GFR is low, glomerular filtration rate, or your BUN is high, or your creatinine is high, that means anybody with abnormal renal function, it can increase lithium toxicity. So be careful. You have to make sure that somebody who his kidney function is not appropriate shouldn't be taking lithium. But it's not the side effect of the lithium I will talk about. I just put it there. It causes nephrogenic diabetes insipidus. But I put this there so that you can know what to avoid in lithium toxicity to avoid it. So you have to make sure their kidney function is normal. Okay. The other side effect, so the second side effect is neurological problem. So neuro. So it's GI symptoms and neurological problem. And they will have tremor, okay, and some confusion. And the bad one is they go into seizure or encephalopathy. So all this is, so there's this thing. Number one is GI, that is the early sign of lithium toxicity. Two is toxic. That means you allow it to occur for a long time, such that a patient will develop tremor, confusion, seizure, then it becomes encephalopathy, which is bad. So we want to prevent number two. We just want to deal with number one. As soon as I see number one, I got to do a mitigation thing as a nurse. You have to intervene. Don't let the patient progress to number two as the side effect. Okay. The third one is it causes nephrogenic DI, diabetes insipidus. You can watch my DI lectures. I did a DI lecture. You can look at it. There's a video on DI and SIDH. Basically, it will make the kidney cannot recognize ADH. So you may make ADH, but ADH will not bind to the ADH receptor, so it can absorb water. So what happened in DI? Well, if it do as if they don't have ADH, but for nephrogenic cause, they have ADH, but ADH doesn't work. It doesn't matter. If you have it, it doesn't work. You still have symptoms of diabetes insipidus. So they have increased urine output. The urine specific gravity is what? Urine specific gravity is down urine, and then they'll get dehydrated, and therefore they have specific gravity or serum specific gravity is high. Their serum sodium is high, and they become dehydrated. So this is just briefly what will happen in nephrogenic diabetes insipidus. So that's how you can connect it to that. Lithium can cause that too. Okay, what should you avoid teaching so that they can prevent this problem? Okay, what should you avoid? So that's what we're going to talk about. So what should you avoid so that you can prevent lithium toxicity? I told you, I briefly said it. The kidney is the one that clears lithium. So if your kidney function is low, renal function will become toxic. So avoid anybody whose kidney function is bad. You shouldn't give them lithium. Based on that, I'll show you something. Well, anything that affects my kidney, if I'm on lithium, is going to cause me to have lithium toxicity. And NSAID is notoriously bad for the kidney. NSAID is not good for the kidney. So that's why when you have diabetes, kidney problem, they want you to stop taking NSAID. You have hypertension, you shouldn't take too much NSAID because you make the kidney mad and you can increase your blood pressure. So NSAID is not good. So NSAID is not good. It affects the kidney. If it affects the kidney, then you have high lithium level because the kidney doesn't work. So they should avoid it. Another medication too they should avoid is thiazide. So somebody who have bipolar and they have blood pressure problem, you shouldn't give them thiazide because thiazide will increase excretion of sodium will go there. So a thiazide or laces will get rid of sodium. That's how they help with diuresis and lower your blood pressure. Then somebody will say, why do you say sodium? Thiazide increase secretion of sodium. How does it relate to lithium? Unfortunately, if this is the kidney, sodium and lithium have the same charge. So sodium, lithium, and water go in the same direction. So your kidney, if your sodium is low, okay, if there is low sodium, it's low, the kidney will know that. All you know is lithium and sodium has the same charge, +1. So I just need, the body want the cells, every cell should have the same electricity, the charge. It should be neutral. So there's a positive here and there's negative inside. So the charges has to be normal. And so if I'm losing sodium, which is plus, well, I need to get something that is plus. So he end up absorbing lithium more. And therefore, when you have low sodium will cause increased lithium absorption. And therefore, your lithium in your serum will go up and your lithium level goes up. So avoid thiazide. Based on that, you should tell them to make sure their salt intake, sodium intake is normal. So maintain your sodium. If you're taking lithium, don't lower your sodium. Otherwise, if you lower your sodium, your kidney will absorb more lithium and you get lithium toxicity. Because we got to help the kidney function, well, I should drink a lot of water, 2 to 3 liters of water a day, so that the kidney will remain normal and flush things out and help with the function of my body. Based on this, you can educate the patient. So this is what you're teaching right there. Don't take anything that affects your kidney. Avoid NSAID. Don't take thiazide. Make sure your salt is normal, and then you're drinking a lot of water. You see what I've done? I've just give you a starter question teaching right there. And that's the next one. So like I said, you tell them to avoid the let's go back in terms of teaching. Okay, anybody on lithium, tell them continue to take sodium. Make sure your sodium is normal. Avoid dehydration. Okay, don't take NSAID. Avoid hydrochlorothiazide, anything that will affect kidney. Make sure your renal function is normal. That's your teaching right there. So what happens if they come to the hospital? Well, they come to the hospital, you know the symptoms they're having. They don't want to stop. They don't want to sit down. They're moving non-stop. And I told you, number one is their physical need. So provide their physical needs for them. And somebody who is moving, okay, he cannot stop. He cannot stop. Can you get him to eat? No way. So if you have to give them food, what do you think? What kind of food will you give him? You want to give them food, they can just pick it up and go because they can't sit down, right? So the food you give them is snack. You give them a snack so that they can take or meal to go meal. So to go meal like what? Hamburger is easy. Burrito is easy, right? Milkshake, it has a lot of protein in it, right? That is easy. Give them granola bar. They can take it and just keep on walking. They're eating. Some juice. They will be fine. Pizza. So you're giving them something snack to go, finger food. That's what I call it. Give them finger food. Okay? And the food that has high calorie and high protein. And that's all we listed. Like milkshake, hamburger, juice, pizza, sandwich, burrito, granola bar with a lot of energy because they keep on moving non-stop. They don't want to stop. So they're going to exert themselves. They're going to get weak. They don't know because they are in the Maniac episode. But after the episode go away, they can see that they've lost weight. They get tired. So you got to take care of their physical needs. So you provide them with high protein, high calorie, high protein, high calorie food. And by that food has to be something they can pick it up and because they won't sit down and eat with you. They won't do that. They will keep on going non-stop. So high calorie, high protein meal, and easy to pick figure meal like snacks, shake, pizza, hamburger, juice, granola bar, that they can take easily. And then if they are in the hospital, after you provide their physical need, then you go into their psychological need. So number one, physical need. And that's the nutrition, hydration, and other things. Secondly, you provide their psychological need. These people, they already ramp up. Everything is high. The way I see psychological treatment, everything is already high. So what I want to do is bring them down. So stimuli, low stimuli, bring everything down. So what do you think? How can you bring them down to normal level? Well, quiet environment. They dim the light in their room, okay? So light, low light level. If you want to let them be quiet, well, limit interaction by other people, okay? Let them be alone. If you have to see them, this is very important. They like asking that. If they need therapy, all the time, people, this one is schizophrenic. You think you can just put them in the group therapy when they come in acute episode. Don't fall for that. That is tricky. They're trying to trick you. Somebody with this schizophrenic or bipolar, when in acute phase and you starting therapy, it has to be one-to-one. One-to-one therapy that is the first way before you put them in the group. So one-to-one therapy, answer choice, don't put group therapy. One-to-one therapy is better. And then provide them with structured program, okay? 2 o'clock, we're going to eat. 4 o'clock, we're going to sleep. So, I mean, it's something so that they can stay focused. They have a plan. In 2 o'clock, this is the plan we're doing. And then you give them activity, everything is scheduled so that they can know what it's doing. They have too much energy. And they have to dissipate those energy. The energy in them is so much, you have to help them so that they can deposit the energy. So give them activities to do. So you give them activity, so activity, plan activity, and you said, go hit the ball or something, go let the energy get out of you. And that will improve their function. So this is how you can take care of them. And finally, you got to set limit. Okay, otherwise they will manipulate you. So this is intervention. Like I said, I always like to teach like I'm presenting a SATA question, and that is what they will ask you. And so when you when you look at my videos, you realize that SATA question is nothing. It's that signs and symptoms intervention, presentation, medication management, and the side effect. It's just nothing. It's just a way for them to make you worry about it and basically make you be scared about that. But it's easy. They're just trying to trick you, but that is all. So let's see what we have. So we have a question, so we can try if we learn something. A client with a known diagnosis, bipolar, present to the mental health clinic. Which of the following assessment need immediate intervention? So like I do, I teach you guys all the time. You read and underline keywords. Keywords what? Intervention. I need intervention. So something bad. Patient has bipolar. Okay. And so I found an assessment. So I found something that needs something intervention right away. So which one? Pressure speech. Whenever this is a priority question, immediate intervention, and I told you if there's a priority, look for B sharp, not expected. So anything that is expected is bad. It is okay. I'm looking to be sharp. So pressure speech is an expected finding. That's what they have. Delusion is an expected finding. Insomnia, because they're moving around, expected finding. Nausea, that is the GI symptoms. Early sign of toxicity. You got to do something. So D is the right answer. Starter question, the same trick. You read the last statement and form your words, and then use every answer choice has to satisfy those words. Which of the following require further teaching? So I need to provide teaching. A client with the history of bipolar is a bipolar disorder. Was admitted for maniac episode. So he had episode of maniac. Now he's saying something that need teaching. Okay, fine. I will need frequent lab work. Well, yes, I mean, because you on lithium, therapeutic effect is very low. So this is good. But it doesn't, that means it doesn't need teaching. So what it means is I will need frequent lab draw. That is good. So it does not need further teaching. So I will just put the X there so that it doesn't confuse you guys. But in my mind, I know what I'm saying. I will use acetaminophen for pain. I told you the kidney function affect lithium level. NSAID affect lithium level through the kidney. Therefore, Tylenol is better. Acetaminophen is better than NSAID. So this is not bad. I will continue to drink 10 cups of coffee a day. Coffee will make you dehydrated. So dehydration. So dehydration, low sodium are the major side effect of lithium toxicity. So you should avoid those. Dehydration, low sodium should be avoided as much as possible. And the renal function, if your renal function is low, Dehydration and low sodium is what causes lithium toxicity. Drinking 10 cups of coffee a day will make you dehydrated. So I will add salt substitute to my diet. This is tricky. Salt substitute means they're replacing sodium with potassium. That is what salt, that means they don't eat salt anymore, but salt substitute has more potassium in it. That is bad. They should not avoid low sodium. They should maintain their sodium level. So this is it. I will take Zofran with severe nausea. Well, if you have severe nausea, that is GI toxicity. You should tell your doctor. Oh, so this is they need a further intervention for this. Sorry, and then this one to further intervention. That's what I want to plan into. So this they need further intervention. This they need further intervention. I will take Zofran. So if you take Zofran for severe nausea, that's the early sign of toxicity. That's bad. You need further teaching. I will have sugar-free candy for my dry mouth. I told you the expected side effect of lithium is dry mouth, weight gain, and drowsiness. And therefore, that is what we call DWD, dry mouth, weight gain, and drowsiness. For lithium, expected finding dry mouth, weight gain, and drowsiness. So if you have dry mouth, you should have sugar-free candy. That is okay. So this is, you have 3, 4, 5 as the answer. So thank you for listening and good luck in your exams.